In this class, we have reviewed every major organ in every system of the body, including its name, location, and function. In this last section, we will review body structure from a regional perspective. We'll put names on superficial landmarks that we've seen on ourselves and others. We will palpate structures that we've felt before but didn't know what they were. As we review these things, it would be prudent to remind ourselves that we have only scratched the surface. We have covered a very small percentage of the anatomy and physiology of the body. In spite of how complex it appears, based on our study, the body is in fact many times more complex. If we have learned anything at all, hopefully we realize that we have not learned very much.
Hi, I'm Mike Shively. Welcome to Introduction to Anatomy and Physiology. In this, our final session, we're going to review some of the things that we've talked about previously, and I also want to consider some surface features and regional anatomy. You know, it's hard to believe that we've actually considered the whole body now, talked about every major organ and all of the major kinds of functions. And yet we've really, as mentioned on that pre-tape video segment, just scratched the surface. There's so much more that is known than what we have covered in this class. Let's list verbally the cavities of the body. I'm talking about the big cavities that contain organs. What kinds of things would you think of? Susan, what do you think?
Cranial cavity.
Cranial cavity, what kind of thing would be in there? A brain would be in the cranial cavity, okay? Eva?
The thoracic cavity.
Thoracic cavity, what major kinds of structures?
Lungs, heart.
Lungs, heart, esophagus pass through.
Trachea.
Sure, there's several others, large blood vessels, lymph nodes. Another cavity. Seth, you have one?
Abdominal?
Abdominal cavity, what kinds of things?
Intestines, mostly, and stomach, liver.
Intestines, stomach, liver, spleen would be in there, kidneys would be in there.
Aren't kidneys retroperitoneal though?
But they're in the abdominal cavity, Susan.
True.
We're not talking about serous body cavities. We're going to do that in just a second. Now, some anatomists will combine the abdominal cavity with the pelvic cavity, which is really a continuation of it, and you'll hear the term abdominopelvic cavity. Just want you to know that that there's really no distinction or difference since they are continuous with each other, the abdominal cavity and the pelvic cavity. Sometimes, again, we'll use that term abdominopelvic. Let's look at a graphic on these and make sure that we all understand cranial cavity, thoracic cavity, abdominal cavity, pelvic cavity, continuous, and this term could encompass those two together for those that are bothered by just saying abdominal. Quite often we just say abdominal cavity and we mean to include the pelvic cavity with that. Now, there are organs in these cavities, but many of these cavities are lined by serous membranes that cover all of those organs and line the inside of the cavity such that there's actually no structures per se within those serous body cavities because the organs are simply invaginated into the sides of the cavities without being inside of them. So what kind of cavities are we talking about when we say serous body cavities, Adam?
Like the left and right pleural cavities?
Left and right pleural cavities. Hazel, can you think of one?
Yeah, your pericardial cavity.
Pericardial cavity, and there's another really important one. Eva?
The peritoneal cavity.
Peritoneal cavity. Now what if I were to say in addition to those we have a vaginal cavity in males? How would somebody explain? Is that an additional one or is that a subdivision or what? Eva?
It's kind of a subdivision of the abdominal cavity. Not really. Isn't it from the peritoneal cavity? I mean.
It's actually an extension of the peritoneal. When we talked about the male reproductive system, we talked about this, didn't we? And we said that in males, the peritoneal cavity extends on down through the inguinal canal into the scrotum surrounding the testis and epididymis. They're invaginated into it. So the vaginal cavity is really kind of a subdivision or extension of the peritoneal cavity. Let's look at a graphic on those serous body cavities. Remember, these particular cavities contain no organs. There are organs that are invaginated into the sides of them but are not inside of them, if that makes sense. Left and right pleural cavities, pericardial cavity, peritoneal cavity, and we probably should have inset the vaginal cavity under peritoneal cavity rather than listing it out here by itself, because it almost makes it look like we've got 4 different kinds. But this last one is really a subdivision or an extension of that one. I want to look at the next graphic, which says systems present in limbs. I want you to think about that for just a second. What body systems are present in our limbs? You understand what I'm asking? We listed at the beginning of this course, we listed what? 12 different body systems. And we said that one individual has how many of those 12? 11. Because as an individual we have either a male reproductive system or a female reproductive system. So of those 12 or the 11 that you own, how many of those are in your limbs? Let's just list them one at a time. What are you thinking, Adam?
Skeletal.
Skeletal system. There's examples of skeletal structures in our limbs. What's another one? Amber?
The muscular system.
Muscular system. Hazel?
Integumentary system.
Integumentary system, present in the limbs, isn't it? So we got skeletal, muscular, integumentary. Eva?
Nervous system.
Nervous system, present, yes. Susan?
Cardiovascular.
Cardiovascular system is present. Let's see, that's 5, isn't it? Is there another one, Adam?
Integumentary.
Oh, Hazel mentioned integumentary already. Amber?
The lymphatic system.
Lymphatic system. So let's see if I can do all those now without messing up here. We said skeletal system, muscular system, integumentary system, cardiovascular system, lymphatic system. What am I forgetting? Nervous system. Those are the 6 systems that are found in the limbs. The other body systems have no components in the limbs. There are only 6 systems present in the limbs. Let's look at this next graphic for just a moment. Contemplate it. What body systems are not present in the head? So I'm doing it in kind of a negative way here because it'll make a shorter list, actually. Susan, what are you going to think of? Not present.
Digestive.
Well, you know what?
Well, the mouth is.
Yeah, I think there's
Urinary.
urinary system. Okay. Okay, we're going to have to count digestive as being present, right? Because we got mouth, oral cavity, teeth, tongue, a bunch of digestive structures. But you're right, urinary system is not present. Adam?
Male and female reproductive.
Neither the male nor the female reproductive system. So we've got basically urogenital components are not present in the head. Can you think of any other system that doesn't make a presence in the head?
No.
It's just those 3. In fact, we all have 9 systems that are present in the head, and only the 3 male, female reproductive, and urinary are the 3 that are not present in the head. All right, now let's get a little tougher one. Let's go to this next graphic and look at it for just a minute. What systems are found within the thoracic cavity? Now, when I say within the thoracic cavity, I am not counting the thoracic wall, okay? So we're not going to count the rib cage per se. We're just going to count the space. What organs are within the space that are considered to be the thoracic cavity? Does that make sense to you? That's what I'm trying to get at here. Amber?
Cardiovascular system.
Okay, we got cardiovascular. We got cardiovascular organs in there. Adam?
Respiratory.
Respiratory organs are present. Hazel, do you have one?
Is your lymphatic system present?
There's lymphatic organs present in the thoracic cavity. Eva?
Digestive.
Digestive. Okay. Seth?
The nervous?
There's some nervous system components present.
Has anyone said endocrine?
Well, let's think. If we're going to count the endocrine system as just the true endocrine organs, then it wouldn't be. But let's ask this question. Are there any hormone-producing structures found within the thoracic cavity? Yes, there are, right? We got heart that produces a couple of hormones. Developmentally, at least, we have the thymus, which produces thymosin. So we do have some hormone-producing structures, but we don't have any true endocrine organs that, quote, belong as organs to the endocrine system present, do we?
Well, wouldn't the thymus count?
Now, the
As
thymus
a-
actually, as its home system, Susan, is considered to be the lymphatic system, because it does something besides produce a hormone. It produces T, the thymocytes, which are the precursors of T lymphocytes that we talked about. Now let's see if I can summarize what we said. I don't know if we got them all yet or not. We said cardiovascular, right? We're looking for things in the thoracic cavity. Okay, there's cardiovascular structures there. There's digestive structures there, lymphatic structures there, nervous structures there, respiratory structures. You think of anything else?
Muscular.
Not in the, well, not really.
Diaphragm.
Because we're talking about the diaphragm, though, when I said we're not going to count the thoracic wall, if we're not going to count the rib cage out here, we're not going to count the diaphragm itself. Now, there is some skeletal muscle tissue present in the thoracic cavity, but it doesn't belong to a skeletal muscle. What are we talking about, Adam?
Belongs to
The
the digestive.
esophagus.
It's part
the
of the
tracheal.
esophagus.
That's right. In the upper part of the esophagus, we have some skeletal muscle tissue. I believe, help me if I'm wrong, if you can think of another. I think that's the only place that we have skeletal muscle tissue present in a non-skeletal muscle, per se, in the upper part of the esophagus. Now, but we're not going to count that as muscular system for the same reason that we didn't count the couple of hormone producers here as endocrine system, per se. All right. Let's go to this next one. Systems found within the abdominal cavity. Within the abdominal cavity. Again, I'm not going to count the abdominal wall. So it's within the cavity itself. We'd have most of the things that we listed for the thoracic cavity, would we not? Which system would we have listed for thoracic cavity that we will not list for abdominal cavity? Eva?
The respiratory system.
Respiratory system. There's no respiratory organs found in the abdominal cavity, but there are cardiovascular organs, there are lymphatic organs, there's nervous system organs. Now we're going to have to mention a few other systems, though. How about
Urinary.
there's urinary
And the
urinary
reproductive.
organs, male and or female, depending on which you are, reproductive organs that are present. And then one that we tried to list for the respiratory system and ended up not, but we're going to have to say for sure, yes, it's true for the abdominal
Endocrine system.
endocrine system. And what endocrine organ, what true endocrine organ is found in the abdominal cavity?
Good.
Suprarenal glands.
Yeah, suprarenal glands, adrenal glands is probably the way they're more commonly known, but suprarenal is another name for those organs. Kind of interesting to think in a little bit different way, isn't it? We've been thinking so systemic all along in this course, and now we're suddenly having to go and think in a different way. Now here's a tougher one. Let's go to this graphic. Systems containing smooth muscle tissue, where we're saying that in some of the organs. Now, I want to tell you that if the only smooth muscle tissue present in some components of this system happens to be smooth muscle in the wall of blood vessels, I don't want you to count that true for that system, except, of course, for the cardiovascular and lymphatic systems where we will, when we're talking about vessels. But in other words, as an example, we would not count muscular system here because, yes, skeletal muscles have smooth muscle tissue in them, but it's just there because it's present in the walls of the blood vessels. That makes sense? So I want you to think of smooth muscle tissue, except for cardiovascular and lymphatic. Let's go ahead and get those listed right away so that we've got those two out of the way. But what other systems contain smooth muscle tissue that's not just associated with the vasculature? Eva?
Reproductive systems.
Reproductive system, both male and female. Seth?
Digestive system.
Digestive system. Adam?
Nervous system in the eye.
Nervous system in the eye. Isn't that interesting? The eye is a special nervous system organ, isn't it? So we do have to count the eye from that standpoint. Eva?
Where'd it go? I was just thinking of it. Now it's gone. The respiratory system.
Respiratory
bronchioles.
system. You know, let's go back to something that we talked about in our first session. You remember when we, or maybe it was our second session, when we talked about the visceral body systems?
Right.
We said the characteristic features of visceral body systems was tubular design, right? One or more openings to the outside, and a mucous membrane lining, okay? Well, all mucous membranes have some smooth muscle tissue in them, and essentially all the visceral body systems do have some smooth muscle tissue in several of their tubular organs as well. So we're going to basically mention the visceral body systems plus the cardiovascular system plus the lymphatic system and the nervous system because the eye that Adam brought up. Here's another pretty tough one. Let's look at this graphic. Systems that contain glandular epithelium. Systems that contain glandular epithelium. Susan?
Wouldn't that be all the visceral systems again because of the mucus membrane
All the
lining?
visceral body systems. So we got 5 of them if we count in the 12 system way of enumerating systems. We got 5 of those. Then there are some others that are not visceral body systems that have glandular epithelium. Eva?
The endocrine system.
The endocrine system, all the endocrine organs are endocrine or glandular epithelium, are they not, Adam?
Integumentary?
The integumentary system. There are sweat glands and sebaceous glands and ceruminous glands and mammary glands, all associated with the integumentary system. Anybody think of another one? We got it with the visceral and the endocrine and integumentary. Is there another system with glandular epithelium? I think that may be it. Now here's a real tough one. Let's look at this graphic. I want you to think of systems that have structural components in every other system of the body. Now just take a moment and contemplate what we're saying. What are the systems of the body that have at least some structural components in every other body system? What are you going to list, Susan?
I would say cardiovascular.
Cardiovascular. There
With
are,
the exception of the lens of the eye.
but
that's
you
not
got to
a
remember,
system.
we didn't.
The rest, it's not a system,
It's not a
right? That's
system.
true.
So-
We do have to remember that this system doesn't have to be present in every component
Right.
of every system. We said at least some components. So cardiovascular system there's vessels in the
Yep.
brain and
Right.
and nerves and so forth. So we got cardiovascular system within the nervous system. So cardiovascular system, it's present in every body system. Amber?
The nervous system?
The nervous system. Nervous system is present in every body system. Adam?
Lymphatic?
Lymphatic system is present in every body system. We just got 3 so far, cardiovascular, lymphatic, and nervous. Are there any other systems present in every other body system? I think it's just those 3, really, when you get right down to it. Well, those are kind of brain teaser kind of things, aren't they? They make you think in a different sort of way. I want to go over some surface features of the body and some other kinds of landmarks that we haven't done thus far. And a lot of these, once you hear the name, you know exactly what we're talking about. I've got, looks like 11 specific surface features of the head. And when they're basically regions of the head, and when I say it, I want you to point to it on yourself. Some of these you've heard before, and some of them you may not have heard before, but I bet you know most of them. So let's see how you do here, okay? If I say frontal region of the head, where are you going to point? Frontal region. Okay, and what's the bone that's deep there? Frontal bone. You know, I bet that's the reason that the anatomist decided to call that the frontal region, huh? Okay, so you didn't have any trouble. You may have never said, well, this is my frontal region, you know. We often say this is my brow, you know, or forehead, we often call it. All right. How about parietal region? And you're doing that because there's a bone there called the parietal bone, okay? See how easy this is? How about occipital region? Okay, there's a bone back there called the occipital bone. How about temporal region? Good, there's a bone there called temporal bone. There's a muscle there called the temporalis muscle, yeah. How about zygomatic region? And there's a bone deep there called the zygomatic bone. Out on the street, we often call it the cheekbone. You bet. That's the zygomatic region right there, okay? How about orbital region? Now, I'm going to ask you to point out some margins of the orbital region, okay? I want you to point out the supraorbital margin. Supraorbital margin. That's going to be the top edge of the orbit, right? How about the infraorbital margin? Bottom edge, okay? How about the lateral orbital margin out here? And the medial orbital margin. All right? What about the infraorbital region? Infraorbital region. Okay, it's going to be maybe perhaps a little bit medial to the zygomatic region and maybe a little bit below, right? We're going to be just kind of hairs on the sides of the nose region. Does that make sense? About the nasal region itself. Okay? Oral region. All right, here's one you may not know. Mental region. And if you happen to know that the Latin word for chin is mentum, then you've got it. Buccal region. Buccal region. Okay? The bucci are the cheeks, are they not? The cheeks. So the buccal region is out here. How about oral region? A-U-R-A-L. It's oral and oral, you know. Tomato, tomato. Spelled with an O, we're talking mouth region. Spelled with an A-U-R-A-L, we're talking the region of the ear. Okay, very good. Now let's move down to some other regions in the vicinity of the neck. The front of the neck is the cervix, and the back of the neck is the nuca. We commonly call that nape of the neck. But there are some interesting regions on the neck. I want to bring a model up here and go to the overhead camera for part of this. So let's look at this model on overhead camera for just a moment. I want to show you the anterior cervical triangle. Now this is just a half a head here, okay? This person ran into a mid-sagittal plane going pretty fast, okay? And this is the bottom edge of the mandible. This muscle right here is called the sternocleidomastoideus muscle. Okay? It gets that name because it attaches down to the sternum, to the clavicle, and then goes up here to the mastoid process of the temporal bone. And there's a triangular region, it's a virtual triangular region, if you will, bordered by this edge of the mandible, by the sternocleidomastoideus muscle, and actually by the mid-sagittal plane or median plane, which the section view actually represents here. And that is called, that triangular region that's identified there, is called the anterior cervical triangle. And it actually has some muscles within it that will divide it up into 4 smaller triangles. Eva?
So is that a paired structure? You have
Yes.
one on either side?
Yes, there's a left one and a right one. And there's actually 4 smaller triangles within that anterior cervical triangle. We'll not try to identify those right here today, but surgeons often talk about, you know, make an incision in the anterior cervical triangle in the region, you know, of the carotid triangle or whatever, one of these other triangles, to get to such and such a structure. Another triangular region that is identifiable here on this model, if we go back to the overhead camera, is the posterior cervical triangle. Perhaps I hold the model up like this. You can kind of see the triangular area that I'm outlining with my fingertip. It too uses this muscle for one of its borders, sternocleidomastoideus muscle. Down here it uses the clavicle or collarbone for one of its boundaries. And then back here, posteriorly, it uses the edge of the trapezius muscle. And those three structures, sternocleidomastoideus muscle, clavicle, and trapezius muscle back here posteriorly, then serve as the boundaries of the posterior cervical triangle. One other landmark that's kind of obvious, sternocleidomastoid region, if we go back to this model again, between the two triangles, anterior cervical triangle and posterior cervical triangle, this part of the neck where this muscle called the sternocleidomastoideus is found is called the sternocleidomastoid region. Any questions about those landmarks in the region of the neck? Remember, cervix, used alone, refers to anterior part of the neck. There are a lot of organs that have a neck. The cervix of the uterus is the neck of the uterus. And the reason that there's some confusion sometimes is oftentimes in medical settings when we know that we're talking about female reproductive viscera, we'll just say cervix alone and the implied meaning is that we're talking about the cervix of the uterus. All right, on the trunk, if I were to say to you pre-sternal region, what would you think? Actually, it's just the area in front of, anterior to the sternum. If you go way up to the top of it, you know, you can palpate the jugular notch of the sternum, right, kind of in between where the two clavicles are coming in. And there's another landmark, this skeleton. If the camera can move over here to this skeleton for just a moment. If we turn the skeleton kind of sideways here, the top part of the sternum, called the manubrium, joins with the body of the sternum right in this region right here. And it's not a perfectly flat plane. There's actually a little bit of an angle kind of like this where those two come together. Manubrium up here, body of the sternum down here. As viewed from the side, that angle that occurs right there is called the sternal angle. So that's one of the landmarks that's found in the pre-sternal area. All right, supraclavicular fossa. Supraclavicular fossa. All right, everybody's doing a good job of pointing to it. It's good. Supra means what? Above. Clavicular means what? Clavicle. And fossa implies what? A depression. So we're talking about a depression above the clavicle, and that's exactly in the right place. You all found it. How about infraclavicular fossa? See, these names are really quite descriptive, right? All right, so now we're just down below the clavicle. And if I were to say clavipectoral triangle, clavipectoral triangle, what would you think? What would the boundaries? Okay, everybody's trying to find it, and you're doing a pretty good job. You're in the right vicinity. What would the boundaries be? Clavipectoral triangle. Certainly the clavicle ought to be one, okay? And what else are you thinking? Pectoral muscle. Yeah, major pectoral muscle. Okay? And then I'll tell you the other side of it happens to be out here in this big muscle that kind of caps the shoulder. The third boundary is actually everybody know the name? Deltoideus muscle. So that's the clavipectoral triangle. Really, the clavipectoral triangle and the infraclavicular fossa are almost the same. Just think of the fossa just being the deepest part here and within the clavipectoral triangle. Does that make sense to you? Okay. Pectoral region. Where would the pectoral region of your trunk be? And one thing I want to emphasize on these regions and the names thereof is most of the time they're named according to some deeper lying structure, right? And we've talked about that a bit already. If we go over to Mr. Muscle model right here, and the pectoral region is so named because, again, it's superficial to the major pectoral muscle. That makes sense? You know, just like sometimes we use bones, sometimes we use underlying muscles and so forth. Now the mammary region is just below the pectoral region in the vicinity of the front of the chest where mammary glands would be. Males have mammary regions, they just don't have actively secreting glands in those regions. And below the mammary regions is a region on the front of the trunk called inframammary region, I-N-F-R-A, implying below the mammary region. Does that make sense? Mm-hmm. All right. Axillary region, where would that be? Axillary, armpit area, right? The axilla is the armpit, so the axillary region would be the region of the armpit. Intercostal spaces on the trunk. Let's go over here to this skeletal model for just a second. These are the ribs, or the costae, and the spaces in between them are the intercostal spaces. Now, of course, in life, there's smooth muscle structures there. There's actually muscles called intercostal muscles that occupy those spaces. But the intercostal spaces then serve as a convenient a locus where a thoracic surgeon could actually make an incision through soft tissue structures and then get into the thoracic cavity by passing between a couple of ribs. And those ribs will spring apart. They have retractors that will spring them apart. Adam?
Was that smooth muscle structures or skeletal muscle structures?
Skeletal muscle structures. Did I say smooth muscle? I did?
Yes.
Oh, well, thanks. Just see if you were paying attention. Okay. The costal arch. Now let's go back to this skeletal model for just a second because it demonstrates it very nicely. The costal cartilages of these false ribs down here kind of curve up toward each other and form the left and right costal arch. Now if you're, go back to me for just a second, if you're relatively skinny, I'm not particularly skinny, but you know, and you can grab your own left and right costal arches right up here, okay? You can kind of jam your fingertips in there. It doesn't feel particularly good, no. And if you're ticklish, you may have trouble, you know. It's a funny thing. Have you ever noticed that if you're doing it, it doesn't particularly tickle, but if somebody else is doing it, it bothers you a whole lot? Mm-hmm. Yeah. I don't know, there must be some deep psychological thing there. You know, maybe some of us were scarred as younger children or something. The infrasternal angle, going back to the skeleton one more time, is actually the angle that the two costal arches make when they come up and join each other, and that varies a bit from one individual to another. So you see this V-shaped angle that I'm trying to draw here. That's the infrasternal angle. All right, if we go to the abdominal region of the trunk for a little bit, I want to go to the overhead camera, and let's assume this is somebody's abdomen. And there's their umbilicus, navel, just for a landmark. Now if we play tic-tac-toe on this person, we can divide the anterior abdominal wall up into its official 9 regions, okay? The region up here at the top in the middle is the epigastric region. Epigastric. The region around the umbilicus, the center square in the tic-tac-toe game, is the umbilical region. I'm going to write R-E-G period for region, okay? And then the region down below is the pubic region. Now these are all the center squares on the board that we're playing. Epigastric region, umbilical region, pubic region. Then, if we take a look at these two sides on either side of the epigastric region, those are the left and right hypochondriac regions. So this one over here would be the left, I'll write L period, hypochondriac. If I can sneak it all on there. REG for region. And this over here would be that person's right hypochondriac region. So left on this side, I'm not going to bother to label the right one, okay? Then on each side of the umbilical region right here, we have the left and right lateral regions. So this would be the left lateral region of the abdomen. And over on this side, of course, would be the right lateral region. Now, you'll also see these lateral regions sometimes called lumbar regions. So in some texts, these two may be the left and right lumbar regions of the abdomen. And then finally, if we move down here to the regions on each side of the pubic region, those are the left and right inguinal regions. So I'll just label the left one again, left inguinal region. Now these 9, if you count them, squares form the 9 official regions of the abdomen that anatomists have defined and named. They are not, to be honest with you, not used quite as often as a quadrant system. The medical personnel often use just quadrants. And what they do, obviously, is they take the umbilicus and then just draw a vertical line through the umbilicus and a horizontal line through the umbilicus. And then they simply identify then, right superior quadrant, left superior quadrant, right inferior quadrant, left inferior quadrant. Does that make sense to you? I see a couple of blank stares. Let me erase this and let's just do it very quickly. Same umbilicus, same abdomen here. What we're going to do, though, is we're going to draw a horizontal line and we're going to draw a vertical line. And then we're going to call this the left superior quadrant. I'm going to write QUAD for quadrant, okay? And then this down here would be the left inferior quadrant. And of course over here would be the right superior and the right inferior quadrant. What really big glandular structure occupies, well, part of it's in the left superior quadrant, and part of it's in the right superior quadrant of the abdomen. It's, it's within the abdominal cavity, but Eva?
Is that the liver?
The liver. Liver's sitting right in here, isn't it? Okay? And if I were to say which quadrant would you expect to normally find a vermiform appendix in, where would it be, Susan?
The right inferior quadrant.
You bet, because what happens, here sits the cecum right here with the vermiform appendix hanging off of it, and the ascending colon goes up and then across like that. So the vermiform appendix is normally someplace in the right inferior quadrant. Anyway, those are the kinds of orientations that biomedical personnel often use, and so they commonly use the quadrants rather than the official 9 named areas that we first identified in that tic-tac-toe arrangement. Any questions about those abdominal regions? If I were to throw out to you the word perineum, let me write that word on the overhead so everybody can see it. Where on the human body is the perineum? Eva?
Is that in the external genital region, kind of?
You bet. It's basically bottom part of the trunk between the legs, okay? And it can be divided into a urogenital part in the front and an anal part in the back. So that's when we talk about perineum, that's the part of the body that we're talking about. Basically, bottom of the trunk between the inferior limbs. That's enough on the abdominal region. Let's go to the back of the trunk. and talk about some landmarks there. If I say vertebral region, what does that conjure up to you in your mind? Susan?
The spine, the vertebrae.
The vertebral column. Quite often, the vertebral region, when one says that, does not include clear down to the sacral area. It's just primarily the region of the thoracic vertebrae and the lumbar vertebrae. Because if we're going to talk about the region of the cervical vertebrae, we can talk about the neck itself. So, and if we're going to talk about the sacral region of the vertebral column, we can talk about the sacral region. So typically, the formal definition of vertebral region is just that part of the back that includes thoracic vertebrae and lumbar vertebrae. So vertebral region is thoracic and lumbar sections of the vertebral column and the overlying structures as well, of course. And the sacral region is the part immediately below the lumbar vertebrae where the bony sacrum would be found. Or if I say scapular region, where's the scapular region of the body? Okay, you're all reaching good. You found it. And what is the bony prominence that's quite palpable in that region? What is the feature that we're palpating in that scapular region? Adam?
Spine of the scapula.
Spine of the scapula. If I turn Mr. Skeleton around here so that the camera can see it, this, of course, is the scapula, commonly called shoulder blade. We studied this a long time ago in one of the sections we were talking about the skeleton. And the spine of the scapula is this particular landmark ending out here in an extremity called the acromion. This is quite palpable. Even if you're very muscular, you can palpate the spine of the scapula through those muscles. So that's the scapular region. Infrascapular region. If I said infra, what did we say infra meant a while ago? Below. So that would be the region of the back just underneath where the scapula is found, right? And then the lumbar region is pretty obvious. That would be this region yet further down below the infrascapula. So on the back, on the away from the midline, we've got scapular region, infrascapular region, and lumbar region. Adam?
Anatomically, what's the difference between infra and sub?
Not enough to talk about. They have the same general meaning, and as an anatomist, you wonder, well, I wonder why they used that this time and used the other in a similar instance that would seem to call for the exact same term. Can't answer that for you. But in general, there's no difference, none that we should think of. All right, let's go to the superior limb. Now, let's review what the major parts of the superior limb were. I'm going to point to a part up here, and I want you to just blurt out what it is, okay? So, what part of the superior limb?
Deltoid region.
Deltoid region, might call it the what?
Shoulder.
Shoulders, okay? And this part of the superior limb?
Brachium.
Brachium. And could call it in English? Arm. This part of the superior limb? Cubital region, could call it the elbow. This is the antebrachium, okay? Could call it the forearm. And everything that I'm spanning here between thumb and middle finger, what have we got? Manus. Could call it the hand. And this part of the manus up here, carpus. This part of the manus, metacarpus. And these are digits, right?
Digits.
The bones within those
That's
digits are
Phalanges.
phalanges. But the fingers and toes themselves, with the soft tissue and the nerves, blood vessels, and all that, the whole ball of wax is a digit. The bones within those digits are called phalanges. How many phalanges are in this digit?
3.
3. And how many phalanges are in this digit?
2.
2. How about this digit?
3.
3. Okay. All right. How many bones were there in the whole body?
214 or
Depends on how you count
216.
Depends on how you count them, right?
Yeah.
But the two common ways to count them, if you don't count any of the little tiny sesamoid bones in the hands or feet, then you end up with only 206. But if you count the fact that there are typically 2 at the base of each thumb and 2 at the base of each big toe, little tiny sesamoid bones we're talking about, then you end up with
214.
214. And when we do that total number, don't forget that we count 1 for each hip bone or os coxae, even though developmentally there were 3 bones that fused together to make it. And we only count 1 for the bony sacrum, even though there are 5 sacral vertebrae that fuse together to form that structure. We only count 1 for the coccyx, os coccyx, even though there are 4 coccygeal vertebrae that fuse together to make that structure. Remember that? Mm-hmm. All right. Some other landmarks on the superior limb that we didn't talk about, but they're going to be pretty obvious. Pull up my shirt sleeve here. The hollowness at the elbow right here is called the cubital fossa. Cubital fossa. And I don't have very much biceps brachii muscle, but coming down on each side of the biceps brachii muscle, there's a little bit of an indentation. There's one over here on the medial side and one over here on the lateral side. I don't know if that's showing up on the camera at all or not. You know, can you find it on yourself? Coming right down into the cubital fossa. Little tiny bit of a superficial depression. And those are the medial and lateral bicipital grooves. They're called that because they lie medial and lateral to the muscle of intimidation of the 4th grade called the biceps brachii muscle. Okay. Palm of the hand. Actually, it's the whole front side of the hand, but in the limited sense, the palm of the hand is often limited to just the metacarpal region. Back of the hand, or dorsum of the hand, actually is the whole posterior part, but in practical usage, it often refers to just the metacarpal region. So back of the hand could mean the whole thing, or it could just mean this section right here, just the back of the metacarpal region. I think we looked at this before. I don't know if the camera can hone in. I tell you what, let's go to the overhead camera. I think it'll show up on the overhead. Come down to me on the overhead. There we go. This depression right here is an unofficially named landmark, and I think we pointed this out before, called the anatomic snuff box. And there's actually 2 tendons that border it. Tendon of the extensor pollicis longus muscle, which you can pop up subcutaneously, as mine's doing right here, and tendon of the extensor pollicis brevis muscle, which lies on this side of it. That's the anatomic snuff box. I've got a particularly deep one, you know. Let's see what else I had here. The metacarpus itself, stay on the overhead for just a second if you would. The metacarpus itself is dipped out. The palmar aspect is dipped out. The palm of the hand has a concavity to it, you know. And part of that concavity is due to some longitudinal curvatures of the metacarpal bones. Excuse me. And some of the concavity is due to the arrangement of the bones with a slightly concave arrangement from side to side. So we got longitudinal and transverse concavities on the palm of the hand, which are it's absolutely normal to have that. This fleshy landmark at the base of the thumb is called the thenar, or thenar eminence. Similar fleshy bulb over here proximal to the little finger is the hypothenar eminence, sometimes just called hypothenar. If you squeeze in a pincher grip between a thumb tip and another fingertip, in between the metacarpal bones, those are the intermetacarpal spaces. They're often called the interosseous spaces of the metacarpus. Interosseous, what would that mean? Interosseous. In between bones, between bones. Interosseous spaces of the metacarpus. Then, staying on the overhead camera, I don't know how well they show up on camera, but there are typically 3 flexion creases across the carpus. You see these 3 creases? One here, then another just a few millimeters distal, and then a third one even further distally. I think those are showing up. Those are the flexion creases of the wrist, and they're just normal skin folds that occur. Quite often they're called the proximal, middle, and distal wrist creases. Then if I open up, you know, I'm not a palm reader, but there's a crease right here called the thenar crease, right next to the thenar eminence. You see that crease? And take a look at the palm of your own hand and see if you can find it. And then there's another one that's out here a little further out, and that one, well, that mine doesn't show up. We'll go on to these. There's a couple of horizontal ones up here that normally appear. My other one got kind of shy, I guess. These guys are normally there. And then we also have some flexion creases right here at the base of the fingers, as well as at proximal and even at the distal intercarpal joints. Those are folds that simply occur due to the movements, you know, of our hands and digits. The interdigital webs are the soft tissue that's found in between the bases of the digits. Okay? Anyway, those are some of the landmarks that are associated with the superior limb. Let's do some of the same kind of thing on the inferior limb. If I were to say to you, okay, let me turn this little muscular guy around so the camera can see his backside. All right, and let's stay down here on the camera if it can get this low. This is gluteus maximus muscle, okay? So if I were to say, put your own hand on your own gluteal region, you'd know where to go, yes?
Yes.
All right, so that's the gluteal region. Now just below the gluteal region, and imagine yourself in a mirror, or I don't know if the camera can get down just below. Will the camera come down right here? Yeah, it will. This is the gluteal groove. And it is basically the junction between the swelling produced by the gluteal region and the backside of the thigh itself. Okay? Femoral triangle. Femoral triangle is a landmark. If you're an EMT, you know the femoral artery is found in there. If I turn this little muscular guy around to where the camera, let me get over here to the side, to where the camera can kind of come in and hone in on this region right here, down low. The femoral triangle is a virtual landmark that's bordered by two muscles, well actually three muscles. The sartorius muscle, which is this strap-like muscle that obliquely crosses the thigh, and then the adductor longus muscle right in here, and then up here the inguinal ligament, which is the aponeurosis of the external abdominal oblique, bottom edge of it. At any rate, we end up with a triangular landmark, and you can see the neurovascular structures that lie within it on this model. Femoral artery, femoral nerve, femoral vein are all found in there. Anyway, the femoral triangle is a pressure point area where a medical individual professional could apply pressure to stop severe arterial bleeding in the distal part of the limb. Backside of your knee. Anybody know what that's called? It's a region, blank region. Eva?
So the popliteal region?
Popliteal region. Backside of the knee. Popliteal region. And if you've seen somebody walking around in shorts, you know that quite often you see a couple of tendons that make an appearance there as they move, as they walk. There's one on the medial side and one on the lateral side. Those are tendons of some of the hamstring muscles that become subcutaneously visible in that position. Everybody knows what the heel is. Okay? The dorsum of the foot is the top of the foot. Dorsum of the foot is the top of the foot, i.e. back of the foot. It's the part of the foot that you tie your shoelaces across, that you hook the Velcro together, keep sandals on. Okay? The sole of the foot is the plantar aspect. Sole of the foot. That's the side of the foot that you normally walk on. Unless you're dancing with somebody, then you walk on the dorsum of their foot, you know. Okay. Okay, we talked about the interosseous spaces of the metacarpus. Now transfer that down to the foot. That's the interosseous spaces of the metatarsus. So those would be the spaces in between metatarsal bones that would be filled with soft tissue structures. That make sense? And everybody knows what the ball of the foot is. When you rise up on your toes, if you've got normal conformation of your feet, most of the weight is borne by the ball of the foot, okay? And the foot, like the hand, remember how we talked about the hand having arches to it, transverse and longitudinal arches? The foot itself has those same kind of arches on the plantar aspect. And if you have normal foot conformation, if you walk barefoot across a tile floor right after you're taking a shower and haven't dried yet, you know, you'll have the heel part and you'll have the front part of the foot, but there'll be this missing part. You know what I'm talking about on footprint? Unless you've got flat feet. And if you have that conformational defect, I happen to have it, where you're kind of missing the normal arches that are present there, then even the medial central part of your foot will press down on the floor. You know, one of the things we didn't do right before we started talking about some of these special regions of the inferior limb is we didn't review the regions, the major regions that we had talked about before, and I just want to go through those real quickly again. Let me come out in front of the podium a little bit so the camera can catch it. This region right in here of an inferior limb, what's this region?
Coxal region.
Okay, coxal region or hip, and this is the thigh, okay, or femur. This is the knee or genu. This is the crus or leg. And then everything distal to the crus is foot or pes. Tarsus, metatarsus, digits. Hey, good. We made it all the way through the human body and didn't lose a person. That's great. I think we're finished.